It all started with a very simple idea. Tell the stories of how successful middle market CEOs made it to the corner office. I'm Brant Handley, founder and managing director of Resource Options International, or ROI. We're the USA's premier executive search firm focused exclusively on empowering middle market companies to attract, hire, and retain A players while transforming top executives' careers and lives. ROI's Into the Corner office is dedicated to discovering how middle market CEOs advance their career, and we're making these remarkable and sometimes quite unbelievable stories available to you for the very first time. Listen and learn about the challenges they've overcome, the interesting people they've met along the way, and the lessons learned that steered these executives' unique journey into a middle market corner office of their own. I know you enjoy these CEO stories as much as I've enjoyed recording them. So thank you for listening today. And if you like what you've heard, rate us on iTunes or wherever you get your podcasts. I'm looking forward to you joining me on the next great middle market CEO adventure into the corner office. Today, my guest is Dr. Claire Raab, President and CEO of Temple Faculty Physicians, part of the Temple University Health System. Temple serves over 600 physicians and makes over 550,000 ambulatory visits a year in the greater Philadelphia area. Prior to this role, Claire was Chief Clinical Officer of Temple Health, responsible for inpatient quality, efficiency, and capacity management. She started her career as a physician advisor, interfacing with payers focused on medical necessity. Claire completed her BS in economics at Rutgers University, her MD at Jefferson Medical College, and her residency at Jefferson University Hospital. She continues to work with residents and students as a hospitalist, teaching and attending at Temple Health. Dr. Claire Raab, welcome into the corner office.
Thank you so much for having me.
It's great to have you here. I know you've been super busy. We spoke several months ago, but I'm glad we could finally find some time on your calendar. And we always like to start in the beginning, Claire, and hear a little bit about your early family life. Tell us, about mom and dad, where you grew up, part of the country, and what those years were like.
Sure. So I am a New Jersey girl, if you will. I'm from South Jersey, which is very close to Philadelphia. I grew up with two sisters and two working parents. Right. I always say that, I love Philadelphia and South Jersey. I've been trying to, go to other places, try other things, but the universe keeps bringing me back here with different opportunities and such. So.
Were you the oldest of the three, or in the middle, or what's the pecking order?
If you knew me personally, you would find it not to be a surprise that I am the
oldest. The overachiever, right?
My sisters are very well accomplished, but there's something that comes with being the oldest sometimes.
Of course.
That maybe a little bit of bossiness.
And you said both your parents worked. Were they in the medical profession, Claire, or what were their careers and professions?
So my parents are not in the medical profession. They're both, my dad is an accountant by trade and my mom has a marketing degree. But they ran a chicken business. So very entrepreneurial in spirit, and they both worked at the chicken company, and that's where I saw a lot of how far hard work gets you.
Yeah, cool. So that was kind of a side gig for them as they were, pursuing their careers for additional income, or did they do it for fun, or
the opposite. So actually, my grandparents on my father's side were in the Holocaust. And they came over when they were in their early 20s with really farming skills, and they didn't have any family because unfortunately they were murdered in the Holocaust. So a bunch of refugees settled in South Jersey in this town, little kind of one-horse town called Vineland, and they all started on farmings, whether it was the chicken business or eggs or so on and so forth. And my grandparents built themselves up from truly having nothing and no family to being very successful. And so even though my parents have those professional degrees, they ran the business.
They continued on with it.
They continued the business.
Yeah. And did you and your sisters work in it as well? Was that kind of part of what was expected as you were growing up?
it's a very hands-on business.
Yeah.
We didn't work in the business, but we did have what I would consider a side business. So my dad in particular really spent a lot of time when we were younger focusing on teaching us entrepreneurial activities. I have this one distinct memory of saying, Dad takes me out for ice cream, and I say, wow, the ice cream's so good, Dad. I'm little. I really want to work at an ice cream store. And he's like, Claire, you want to own the ice cream.
I love it. What were you, like 5 or something?
Yes. And so, although I wasn't, back to your original question, although I wasn't managing chickens per se, my sisters and I, he did encourage us, because they had a lot of sort of factory workers, to have a vending machine business.
Right.
Cool. And so he bought a bunch of vending machines, and we would go to, like, at the time, the equivalent of like BJ's or Costco. We would buy snacks, and then it was our job to, fill the vending machines.
Right,
yes,
right.
Try to understand what people wanted, and then we had to count all the quarters. And I'm on the younger side for a CEO, but even then we didn't have quarter counters. We had to put them in the wrappers.
Of course.
So we spent a lot of time doing that. So I think in that way we worked at the factory.
That's so cool. So it was the vending machine at the factory, basically.
Yeah,
got it. So it's for the workers and so forth there. That is so cool. How old were you at the time?
Like 10.
Oh, God, that's great. And your younger sisters were younger than you, too, so you all kind of joined in. That is
I remember
so cool.
We made little flyers. We gave them out. Come by. I think it was like, don't fly by without buying a candy bar, something like that.
Love it. Oh, God, I love it. That's terrific. And how many years did you do that? Was that like all growing up, or were there other entrepreneurial things you pursued as a kid?
Yeah, I think that was it.
Were you a good student in school?
Yes.
Yeah.
And a good rule follower.
Stayed inside the lines.
Always.
What were the kinds of things that, other things that you learned from mom and dad growing up? It sounds like obviously hard work, be the boss, don't be the employee. What other kinds of things did mom and dad share with you?
Definitely hard work. I think, when it's your own business or you're deeply committed to the business, it takes a lot of hard work, and it takes a lot of work that maybe is what you might consider outside your job description. So, for example, I told you my mom in her own right is accomplished, but she worked at the chicken company and, in the office. But if it meant that somebody didn't come in the packaging and they were short a person, she'd put on the suit and go back and help out and really be part of the team. Similarly, if the trucks didn't come in, again, my father was the CEO, but he would still drive the truck and pick up.
Make the deliveries.
You just got to make it work. And I think I really embrace that now. You have to really be doing the work for people to see. Because A, the work needs to get done, of course. And B, that's a really great way to bring leadership to a team.
Yeah, absolutely. Demonstrate that you're willing to do anything. Gosh, I love that. Did you have time for any other outside activities? Did you pursue sports or, speak in the, debate team or do anything like that while you're in school?
Yeah, I was the captain of the soccer team, and I played a lot of sports.
Yeah. Cool. Did you have ambitions to go on and play to college? Did you get a chance to do that, or was it more of a high school thing for you in terms of sport?
Yeah, no, I can't claim that it was a college thing. No, just in high school, and I went to a pretty small high school too. So
right.
It was just an activity.
Other part-time jobs before you went on to college that you engaged with or did while you were growing up? Any W-2 work or mostly just helping out at the chicken facility?
Nothing that would impress you in terms of outside work. I think my parents were really focused on schoolwork and had the ability, to provide for us to truly focus on schoolwork.
So you stayed in New Jersey, went to Rutgers. Was that your first choice, or did you take a look at other universities? What made you choose to go there?
Yeah, I actually was supposed to go to Brandeis. Are you familiar with Brandeis?
Sure.
It's in Boston. It's near Boston.
Right.
But at the time that I was supposed to go, there was some family stuff going on. My mom was sick, and I decided that I didn't want to be that far away. Home is home is where the heart is, and
Right.
I'll get to my destination anyway. And Rutgers was a good experience and a good education, so I think I accomplished that.
But you did you study science or economics? What was your degree in?
So my degree is in economics.
Yeah.
I mean, you can hear I was always kind of drawn towards business because of the family history,
Sure. Yeah.
if you will. But I knew I wanted to be a doctor. I just was scared to put all my eggs sort of in that basket. I wasn't
So to speak.
I hate to say this, but I wasn't like yes, totally. I wasn't specifically interested in biology or organic chemistry,
Yeah.
but I was interested in patient care. And
Right.
so I figured, let me get this economics degree, and then I'll take the prerequisites for medical school. And if I don't get in, then I will pursue economics, but
Get your
not
full.
yes,
Yeah.
but not be locked into like a biological science career, which I was less interested in. In the irony of life, yes, I did get into medical school, but I am now in a position that is heavily economic focused.
Right. Well, it was a good choice.
Yeah.
So you'd mentioned that you always knew that you wanted to be a doctor. How old were you when you first had that feeling, and what inspired you?
I don't have any of those like memories or those pictures of me wearing a stethoscope when I was,
Playing Operation.
Yeah,
What was that game that was?
Yes, I don't have any stories like that. I just recall, maybe the end of high school or college, just feeling like what an opportunity to connect with patients and really wanting to find some meaningful work and feeling very connected to that idea. Because even when I decided to pursue medicine, I found myself really looking with the same lens around like which specialties or what focus can I feel like I personally could be the most impactful in terms of patient care.
Right. Did you always kind of have a helping people mentality growing up? Was that part of it, or was it the challenge of being a doctor and what that would entail? Because that's a pretty awesome task in terms of accomplishing and all the
It was less of an intellectual pursuit, just in terms of getting that information and having it from an academic perspective. But it was definitely more around helping people and the sense that if you give, you get.
Right.
And so what a great way to have a fulfilling life by giving to others, really it serves you too.
It's awesome. And so senior year applied to med schools. Is that
Yes.
So no gap in between?
No
You went to
gap.
Thomas Jefferson. Is that also in New Jersey?
No, it's in the city. It's in Philadelphia.
Okay. Got it. And again, your first choice, did you still need to stay close to home? What was the decisions around choosing Thomas Jefferson, or is it because they chose you?
Well, they chose me, but others chose me as well.
Yeah.
But I just, it's a great institution. It's one of the oldest medical schools in the country.
Wow.
And I was excited to sort of be in Center City, which is like our downtown here in Philadelphia versus some of the other options. And so I chose Philadelphia.
Yeah, cool. And you did your internship there as well, I guess. Is that what it's called?
Yes.
Your internal medicine, right? So did that
Yes.
for about 3 years afterwards. And then pretty much stayed in Pennsylvania, went to Penn Medicine, right?
Yes.
In terms of your first job. And tell us about the choice behind making that career decision.
So, I at that time, I really liked Philadelphia. I met my husband in medical school, and sort of our applications were connected to each other. Obviously, the timing doesn't always work out. He was applying for one thing and I was applying for another. His training was longer than my training. So that really affected sort of my ability to move out of Philadelphia.
Sure.
So we were kind of grounded in Philadelphia, but definitely happy to do that. And of course, Penn is a very well-respected institution. They also have a community hospital called Pennsylvania Hospital that is within the city. And my first job was there, which was really a great place to start as a new physician.
Yeah.
Well, I guess, you're a physician when you're a resident, but, you're working without supervision as an attending. And so to start at a smaller community hospital was a great way to sort of get my bearings and learn my trade without being sort of overwhelmed.
Yeah. Total pedestrian question. How close is it to Grey's Anatomy?
It's not as sexy as Grey's Anatomy.
A little over dramatized.
Yeah,
I'm sure.
I'll just leave it at that.
Pretty competitive. I mean, what is it like once you kind of get into that, that mode of, okay, so now you've got to prove yourself.
You mean like as an attendant?
Yeah, as a resident, and then, as you're kind of earning your stripes, so to speak.
Yeah. So, I mean, I don't know if it's competitive. The competitive part is kind of past.
Okay.
Competition is around getting into medical school, which is extremely competitive, and
Right.
then getting a residency. Different specialties have different levels of competition to get the positions. But once you're an attending, you're fully graduated, all not needing supervision. I think the focus is not competition. It was like, oh, well, no one's supervising me, so I better know what I'm doing. And if I don't know what I'm doing, I better know how to get the answer that I need, whether it's where to look, who to ask. And so it's a different skill set than a competitive skill set.
Got it. Well, you started as what's called a hospitalist. Is that correct?
Yes.
Is that your first job? And what is that? Tell us about what that job is.
So a hospitalist is somebody who manages patients only in the hospital, right? So there are physicians, primary care physicians that are certified in general internal medicine that follow, patients through their office, right? Patient comes in and follows them over time in a longitudinal type of way. But a hospitalist is somebody who cares for a patient while they're hospitalized during that episode of care.
And is that pretty much an entry-level type of job? Is that what most doctors do if they come into a university health system like you did at Penn?
So no, it's a full position.
Yeah.
You can be a hospitalist for your entire career if you want to. Certainly, there are people who use it to do it for a few years and then want to become increasingly subspecialized. But it is definitely a career, and I would say it's probably the number one type of physician that has grown over time because it's a very shift-based work, and so people are drawn to it.
So it's patient care. It's essentially serving the patients while they're in the hospital during that period of time, and then they move on and you serve someone else, right? It's not like you continue to stay with them.
100%. So if a patient comes in and they have pneumonia, they get admitted to a hospital medicine service. If they come in and they have a heart attack, they could get admitted to hospital medicine, and you manage them during that episode, and then you connect them back to their primary care physician with a warm handoff to the specialist that they need.
Cool.
One thing that's worth noting is that, hospitalists, by the nature of working in the hospital only and managing patients in the hospital, are very familiar with how the hospital works and hospital processes. And I would say that, that experience has been invaluable to me. So not the knowledge, of course, the knowledge of the different disease states, I need that to do my, to be a physician, but this deep understanding of the interconnecting pieces in the hospital and how they work has been a tremendous asset to me in my day-to-day job.
Do you get training for that, Claire, or is it just something you have to kind of learn by trial and error? Because it's got to be quite complicated, right? There's testing and there's lots of different things that patients have to go through.
So I think that comes with residency. That's really what the residency training is. I mean, certainly they're teaching you about the medical pathology, but also really teaching you about the hospital process,
how things work.
Yes.
Yeah. And are most hospitals run the same way?
Yes.
Yeah. Thank goodness.
Yes.
It'd be hard to go into a new environment.
Yes.
And then you became a physician advisor after that. Tell us a little bit about what that job was. Did you oversee other doctors in that role, or was that a...
No. Like I said, shift work, which is why a lot of people are drawn to it. So it was like 1 week on, 1 week off. But as time went on, I found that was a little tiring. Working every other weekend is hard, especially at that time. I was just starting a family. And so there was an opportunity that was unexpected where a position became open for a physician advisor. So a physician advisor is a physician who interfaces clinically with the physicians at an insurance company to talk about patients that came in and whether or not the insurance company should pay for the care. So just because a patient comes in the hospital does not mean the hospital gets paid. The hospital has to prove that the patient met the medical necessity for admission. And so what I would do, I was tasked with reviewing the denials, if you will, from the insurance company, discussing with the physician on the other end and saying, yeah, you know, Mr. Jones, we couldn't have sent him home because he had this, this, and this, and we had to give, you know, this medication and do this. This is not something that could have been managed in an office. And then the insurance company physician and I decide whether we want to revoke the denial. But what that taught me really was a couple things that have really helped me out. First of all, how to interface with payers. And also that as physicians, I think we think, you know, we do, and it just gets reimbursed, and that's not really the case. And then maybe third of all, that, you know, this idea of medical necessity and levels of care, meaning, you know, where should people with certain medical conditions be treated, right? Should they be treated at home? Should they be treated in the office? Should they be treated in the hospital? And I think with COVID and all these things, this idea has been evolving.
Yeah. And I imagine some of your business training came in helpful in those situations, right?
In college, I learned about economics and microeconomics and macro and statistics. I don't know that really proved to be that useful. Besides, I have a little bit of the lingo, but I would actually say the opposite, that this experience directly interfacing with the insurance company on a day-to-day basis taught me the most about hospital finance.
Interesting. Yeah, cool. And did you have management responsibility there, or were you more of a, you know, individual contributor representing obviously your patients at that stage?
It's a great question, but it was really like a task-based position. Like, this is your queue. You got to get through 30 cases today and provide an output to your manager. And that was really great way to learn, because again, there's no way to learn besides doing it yourself, I feel, in a lot of ways. But after a few years of doing that, I felt like I was getting marginal returns on my learning, which is why I decided to jump ship.
Move on, yeah. And did you have much patient interaction in that role?
Yeah,
probably.
I was 50% patient care and 50% physician advisor at that time.
So less than as a hospitalist, right?
Yes.
Yeah, got it. So you joined Temple, and that was your first gig there, and you came in another role, I guess, medical director, and went on to become an associate chief medical officer. Tell us a little bit about those roles and how they differed from what you did before.
So I came to Temple to be the medical director, which was actually this very similar position to the position I had at Penn, which was physician advisor. The only difference was that in the Temple design, in the Temple infrastructure, the physician advisor, medical director, just a different name, was actually part of the executive leadership team.
Okay.
So it wasn't, yes, I still had to do the tasks, but like I was invited to the meetings.
Yeah.
And so it gave me this other experience. They were like, you know, come to this and help us work on readmissions, come and help us on quality. And so in that job, even though I was still doing the queue, if you will, I was able to see, you know, how the hospital framework is laid out.
Cool. And people responsibilities then in that role?
Yeah, I was in charge at that time of a small group of nurses who provided information to the insurance company pre-auth and all of those types of things.
And they reported into you, or was it kind of a dotted line? Yeah.
No, they reported to me, but around the same time, because you had asked me about, you know, being the associate chief medical officer. Yeah. So I did the medical director job for about 2 years, again, in the executive suite, and I was really enjoying it. And at the same time, in Philadelphia, they had a big hospital system, academic hospital system, that closed down because of bankruptcy, Hahnemann Hospital, which was really taxing to the city and I'm digressing. But anyway, Temple was also struggling. We're a big safety net hospital. We're 87% government pay.
Right.
And it was determined that we were having trouble sustaining any margin. We were just losing tremendous amounts each month. And it was determined that that was really because we were not efficiently running the hospital. Efficiently running the hospital. So one day I came to work just to do my job, and everybody was let go in the entire CEO. You know, I always joke they didn't fire me, but they weren't paying me as much.
Yeah, I remember you telling me the accidental CEO, right?
Yeah, well, I mean, that is exactly what happened.
Yeah.
So, you know, I was left for whatever reason, and they were like, it would be really great if you could reorganize the inpatient hospital processes. And I was very much like overwhelmed because I'm the medical director, and these are really high positions, and it sort of jumped a lot of ladders, rings on the ladder, if you will, rungs on the ladder. So I did it. I mean, I just sort of said like, okay, well, the good news is I'm a hospitalist. And I do deeply understand how the hospital is run. And so I spent the next 2 years really working on, you know, the inpatient processes and ways that we could deliver better care more efficiently and more cost effective. And it was a successful project. And so that.
Did you have some outside models that you used, Claire? I mean, gosh, it sounds like that was quite an overwhelming level of responsibility they gave you. Where did you go to kind of seek direction?
I would just say like personal experience and the fact that, you know, I had a little bit of a burning platform, not in terms of my job security, but really like this other similar hospital just closed. So I had a lot of listeners, if you will, or people on the team willing to change, which I think helps a lot, which I saw in COVID also, right? When the team is feeling agile or has a burning platform, unfortunately, in COVID, you can really make tremendous strides very quickly.
Right. Wow. And did you have any mentors or any advisors that you could reach out to during that period of time?
Well, at that time, the new CEO, who's the present CEO of our health system, Mr. Mike Young, I would say he was an excellent mentor because even though I had this hospital-focused mind, I was trained by physicians, right? So physicians are trained by physicians. We get very little exposure to no exposure in medical school and residency on hospital economics, hospital finance. And so Mike was really looking and saying, you know, if we put money in certain places, Claire, tell me where those places are, how would it help? Which was a very different approach than the physician-led organization, which was like, well, you know, this patient here, and we have to do it this way because that's how we do it. And he just had a much different approach. Tell me how much it's going to cost. And, you know, a lot of the things that we needed to do to put money towards to make the situation better, they really all served patients. So they were that unique situation where you can put money towards. I'll give you an example. So, you know, patients would stay in the hospital a very long time while we waited for their medications to be approved by the insurance company. So a stay in our hospital is about $2,500 a night. The medicine is maybe $60, $100, $500, but we would hold the patient in the bed waiting for the medication to come through. And he was sort of like, well, why don't we pay for the medication?
Yeah.
My training has always been, well, you don't.
Because that's the way it's done. Yeah,
right. And you want to hand it to the patient, but he was like, what if you pay for it and we send a delivery service to hand it to the patient? And I was sort of like, we can do that.
Yeah.
Yes.
So treating, so basically to in layman's terms, you're treating them earlier, right? Mm-hmm. Hopefully they're getting well sooner and therefore not incurring that $2,500 a night, right? You were able to release them sooner. Is that kind of the thought process of changing your system?
So that's correct. I just make a caveat. It's like, these are patients who are not sick anymore that we're holding, you know, because we want to be able to do it a certain way and that, you know, but it's not really necessary. And so when the patient gets the medicine because we paid $500 and saved $2,500. The patient gets to go home where we know they do the best. We have a reliable way to deliver the medication. And then, right now, like every hospital, our capacity is fairly overrun on the inpatient. And so patients that are sick that are coming to our emergency room are having to, they walk out, they leave because the wait is so long and they need care. So why have somebody upstairs who can just as easily get care at home?
Yeah,
but we never thought of the concept. You can spend some money.
Yeah, right. Gosh, fantastic. Great. And what kind of an impact did that have? I'm sure it opened up more beds earlier, right? Got people home sooner. And do you measure, or have you been able to measure the impact of that one change?
In 1 year, we spent $750,000, and we probably made, however you look at it, about $40 million.
Oh, man, that's incredible. Wow.
And, during that same time, again, this wasn't about sending sick people home.
Yeah,
earlier.
no, I understand. They were well already. Yeah,
they were well. And so actually, all of our other quality associated metrics, like hospital acquired infections, they all improved because people weren't sitting there getting whatever's floating around. You know what I mean? And so it was just like a whole different way of looking at things. So I'm very appreciative, for his mentorship.
Yeah, fantastic. So you became president and CEO of the facility back in July of last year, July of 21. And was that, kind of a natural progression, something that you had expected to happen, or, rewards for the fruit of your labor, so to speak? How did that kind of evolve?
So I'm not the president of the hospital. I'm the president of the medical group, which is the physicians.
Yeah.
But of course the physicians touch, the whole hospital and all of the outpatient practices.
Yeah.
So how did I get that job? So this job that I have now is very much a outpatient job. It's a lot more focused on the clinics.
Got it.
How did I get the job? I think that whatever you do, if you can prove that you can have an impact, that you're a person who can take X and make it Y, you're always going to be a candidate for the job. And so I would say I was sort of thrown into these unexpected circumstances running the hospital, and then this opportunity to run the medical group came up, not exactly my past experience, but certainly showing that you can have an impact when assigned allows people to really trust you for the position.
Yeah. So more management, more leadership at this stage. Any patient contact at all? Tell us a little bit about what your role is now.
So when I first started the job, I dropped down a little bit of my clinical effort seeing patients. But as soon as I got my bearings, I increased it back up. I'm about 35% clinical, which is hard because I have a 100% job.
Yeah.
But it's just so important that I know what it's like to be a provider here in this institution. I mean, what a privilege to run a medical group and be able to work in it. I always joke, when I look at how we're doing, I'm like, wow, we're doing so good on this, that this is really improving. And then when I go to see patients, I'm like, wow, there's still a lot of things that we can do. Not to discredit anybody's hard work, but there's a million things that we can do better. But that perspective, I think, keeps me grounded in the goal.
Yeah, that's awesome. And how big is the organization that you manage now? How many physicians and staff do you support?
So there's 600 physicians who are what we call dually employed, meaning they work for the hospital, me, and they work for the dean of the Lewis Katz School of Medicine, Dr. Goldberg. Right. We work together to, manage, develop all the things that the physician faculty need. And of course, they have chairs and department heads that really do that work as well. There are about 2,000 employees.
Wow.
And again, the medical group is only a subset of the hospital, which is a tremendous engine, $2.5 billion, 11,000 employees. And so we're a piece of that.
Yeah. What's kind of your biggest leadership challenge today, Claire?
prior role, when I was running the hospital, I was very familiar with sort of everybody's role, everybody's job,
Right.
and sort of their expectations. Here, when I'm running the medical group, I have to really rely on my team and
Good
my
expertise.
constituents to
Yeah.
listen, to like really
Yeah.
understand what the needs are.
Yeah.
Managing physicians and a physician group is much different than having other departments
Right.
with other kinds of staff, if you will.
Yeah. Like a medical director, like you do.
Yes,
Yeah.
you have to really, really work on partnering.
Mm.
And so that's an everyday activity. I want to get here, they want to get there. How do we work together?
Yeah.
You know, how do we communicate? I always say if I could put a sign on my wall of, you know, what to remember each day, it would say like communicate, over communicate. There is no amount.
Listen.
Yes. Listen, then communicate back, close the loop, which, you know, it's a full-time job really
Sure.
doing that, but I think you'll see tremendous gains, and it really instills trust. So I work on that every day.
Are you involved in the hiring and firing decisions as well?
Yes.
Yeah. Has that been a challenge?
I don't think hiring and firing is a challenge specifically, but what is a challenge is balancing wellness and burnout with the needs of the institution and the needs of the patients even.
Right.
You know, access is really a critical issue, but it really expanding access pulls on sometimes the same resources that are already feeling tired, not just physicians. Really, everyone's feeling tired and burned out. And so how do you balance serving patients without sort of overrunning the staff and the faculty? It's an everyday kind of challenge.
Yeah. When you're making your hiring decisions, do you hire more to culture or to qualifications, or, you know, how do you balance the two?
Here at Temple, we have a very specific culture. I think our culture, if I had to sum it up, would be grit. You know, just kind of working hard, getting it done, you know, focusing on patient care and good quality within the constraints. And there are constraints, right?
Yeah.
And so I try to, when I am hiring people, I want to have that kind of person, a person who's resilient and dedicated to our mission to serve the underserved.
How do you get at that? What kind of questions do you ask?
I like to steer away from, you know, tell me about your leadership style or this or that. I like to move towards, let me give you a situation. What would you do? That really helps me understand how that person thinks.
Right.
And then I would say, you know, we're not the only institution that requires grit. There's certainly others. And so I like to have an understanding from the candidate where they've worked, what their experiences have been, to make sure that this is not, you know, totally different than where they've been, and that they understand some of the expectations and, of course, the joys that come with it and the validation.
Sure. And are you growing now? I mean, I know you kind of went through that Friday afternoon in massacre or whatever day it was when everyone was fired, and are you back in rebuilding mode, and is that continuing to, you know, grow the organization?
Yeah. So, I mean, since that time, with the new CEO, Mr. Young, we have really turned the organization around. He's really been very specific about putting leaders where they need to be to grow, and we've been very successful the past few years, which is always feels good.
Awesome. Terrific. Well, Claire, you've been very, very generous with your time. We've always asked one last question, though, of all our guests, and that's, you know, what kind of career and life advice would you give someone that you know, maybe does or doesn't have their eye on the corner office, but, you know, is specifically growing up in the medical profession and thinking about, you know, leadership responsibilities? What would you say to them if they were, you know, someone who had that in mind for longer term?
Can I give 2 pieces of advice?
Absolutely, as many as you like.
No extra charge, right? Okay.
No extra charge.
I would say the first is always be your authentic self. I think especially as women, people will try to redirect with good intentions, don't laugh this way, don't say it that way. And I think if you lead with your authentic self, that people will see that and they'll trust you. And there's no substitute for that. The second piece of advice I would say is, which I've heard other people say, is work for the job you're in, not necessarily the job you want. And I have seen in my own experience that whatever you're tasked with, big or small, in your present job, if you can impact it and you're successful at that, people see that.
Yeah.
And then when the next opportunity comes up, they said, oh, well, Claire was able to do this. I bet she could do this. And I think that's the best way to climb up the ladder, if you will. So focus on your task at hand and be really good at it.
Awesome. Love it. Dr. Claire Raab, President and CEO of Temple Faculty Physicians at Temple University Health System. Thank you so much for sharing your journey into the corner office.
Thanks for having me. Appreciate it.
Thank you for listening to Into the Corner Office with Brant Hanley. We hope you enjoyed hearing our guest CEO story as much as we did. If you want to hear more CEOs reveal their journey into the corner office, please subscribe via iTunes and tell your friends and colleagues. For more information about Brant, Resource Options International, and the mighty middle market, visit www.goforroi.com. We look forward to having you join us for our next episode.